Hello everybody. Although it's under the title 1 Minute with Paul, this presentation will be a little bit longer. I invite you into the space with a few basic things of medicine. I was born in Romania. It is my pleasant duty to introduce to you the first and only Romanian astronaut, engineer Dumitru Prunaru. We met for the first time 41 years ago when he came back after 1 week in space, and lately a few weeks ago in Bucharest. Talking to the audience, he said that from the health standpoint, they felt almost normal. I asked what was the meaning of the word almost, and the rest is history. I live in Israel. I also want to introduce to you the first and only Israeli astronaut, Ilan Ramon. He was on a Columbia mission STS-107. Unfortunately, the whole crew died upon re-entry of the Columbia shuttle. You see on the right side the remains of the shuttle that burned upon re-entry. It might be counterintuitive, but when we are talking about space medicine, basically we should forget almost everything we know from the medicine on Earth. This is a very crowded slide, I know, but you will read it at your own pace. Basically, it's taking a normal person and asking that person to work in an abnormal environment. It is not always feasible or possible to send a full trained doctor in space, so everyone in different types of crews must know a few things about how to assist just in case injured or sick colleague, and you'll see the rest. On Earth, one of the most trivial procedures is to give perfusions to our patients. It's so simple. You just put an IV line in, you hang a bottle, and that's it. It's not the same in space because fluids and gases do not mix. They look like something like this. See, this is a drawing of a perfusion bag. These are the fluids and these are the air bubbles that do not mix. You need a special device to separate them, like a centrifuge. Cardiovascular system has its own adaptations called deconditioning. Baroreceptors change their function. They do not answer like on Earth to all the cardiovascular stresses. And you have a lot of modifications that imply adaptation on the medication that you give. Again, this is not an extensive description of all the cardiovascular changes that happens. I'm only presenting in short a few things that we should pay attention at. Neuromuscular physiology. In the lack of real muscle use, it's similar to a bed-ridden patient. And you know, like in a paralyzed patient, there are modifications of the neuromuscular plate, potassium going out. So just in case of an emergency, using scoline might produce similar things like on Earth, hyperkalemia and all the rest. The heart changes its shape. You might remember I put this slide on a previous presentation. On the left side, you see the pitch shape of a normal ventricle. On the right side, the way it changes in time. So it's a complete outstanding globe. Gastroesophageal reflexes. Here on Earth, we take it for granted, like eating and drinking. In space is different. And not only that is different, but there is a certain percentage of astronauts that suffer from sick motion disease, like on Earth. In some people, they cannot bear to travel on sea, but in space you cannot just go on the shore. So there is a problem with that too. And many astronauts take anti-vomiting, anti-emesis medication before going on their mission. Sending medical equipment in space, it's not only a matter of adapting the equipment that you take, but how much you take. Because many years ago, sending 1 kilogram of equipment in space, no matter what, you see, was very, very expensive, around 22,000 US dollars. Now, with the progress of the equipment and the spaceships and the fluids and the fuels, it's much less, about 1/3, and still it is very expensive. So you have to choose very carefully what you send and how much you send. As I mentioned before, many members of the crew must master at least a few medical training in order to be able to provide help to a colleague. Also, here on Earth, you have a problem, you need to consult a colleague. It only takes is a telephone and a conversation of a few minutes. In deep space, as we are talking about traveling to Mars, one question takes 20 minutes to reach Earth, 20 minutes to receive the answer, and in the meantime, your colleague on Earth or your colleagues on Earth need to find the answer. Some in-between boosting stations must be thought of. Also, it seems that the best approaches in anesthesia in space are local, regional, and intravenous parts of anesthesia. Using volatile anesthesia gases, it is also theoretically possible, but practically it's very, very difficult to think of, because here on Earth we have a scavenging system. In space, you don't have this. You give oxygen and volatile anesthetic to a patient, it's okay, but that volatile anesthetic goes out. So where do you ventilate it? We use closed environments. As I said, pills can be taken, regional anesthesia can be used, intravenous anesthesia, but the other things that go in and out, like gases, you have problems using them because there is no scavenging system, and sending them outside the wall of the spaceship is also an energy consuming process that you might not have the luxus in space. One of the most frequent procedures an anesthesiologist must master is airway management. Here you see, and in a few other slides, training done in a simulation in parabolic flight, when for a very short period of time, if I remember correctly, roughly 20 seconds, the airplane goes down very fast, so the whole team is for a short while in a so-called lack of gravity. So in this time frame, whoever is training must perform the intubation. You see some other variants also in water, how an astronaut is moving. A whole work has been done by my friend and colleague Dr. Johann Hingelbein from Cular University. You see some other ways of training in airway management. And like on Earth, it seems that supraglottic devices are the easiest to use, because we have all the experience. It's there inserted blindly, and it's very, very easy to do. The problem is that, as I mentioned, with the gastroesophageal problems and the astronauts are not fasted, we might have a problem, but it's probably the only possibility we still have. Here we have a list of many, many other issues that must be mastered. You'll watch this slide at your pace, and it's not simple, as you see. In a normal surgery, open abdomen, for instance, on Earth, if you have blood or other fluids in the surgical wound, someone from the medical team is just using the suction and to clean the view for the surgeon. In space, all the fluids are floating. So another device must be developed for such problems. As I mentioned before, the difference between different types of anesthesia. Thankfully, monitoring has nothing special except for the physical limitations of the equipment and the ventilation. You might need electricity or oxygen to make the ventilator work, and you don't have all the time these facilities in space. So you need to adapt in very, very short surgeries. As you saw, just in a nutshell, how many challenges exist for medicine in space. Yet the experiments have started long before, we are just continuing them. So we can say that the future has started already yesterday. So if you have questions, please contact me. You know where to find me, or here on this site. And thank you very much for your attention. I hope it was interesting. See you next time. Bye-bye.